So good evening to all of you and welcome back to the Mixed Bag series. I'm Dr. Pradeep Pawar, Professor of Anatomy, and I've been teaching the undergraduates and the postgraduate students, especially the entrance students, India as well as abroad. Okay students, so let us continue with the series that we had begun on Monday for you. So this was the slide that I was trying to tell the other day, but there was lack of time. Identify the pointed structure. This is what I was asking you. Identify the pointed structure. Come on students. So first try to identify what is this region. What is this region here? Yeah, this is the gluteal region. That's a gluteal region. And what is this pear-shaped structure which comes in the gluteal region? What is this pear-shaped muscle which begins from the sacrum, which arises as an E-shaped origin, E-shaped alphabet? Anyone? Can anyone guess this? Arises from the sacrum? Yes. This is the gluteal region. And what is that muscle? This pear-shaped muscle. This pear-shaped muscle I'm asking. This pear-shaped muscle which arises as an E-shaped origin. Yes. Xylem, that's piriformis. That's pisiform nahi bacha. It's not pisiform, it's piriformis. Piriformis, it's a pear-shaped muscle. And where is the insertion of piriformis? It is inserted on the tip of the greater trochanter. Tip of the greater trochanter. And this piriformis is known as the KEY, key muscle of the gluteal region. The piriformis is known as the key muscle of the gluteal region. Why? Because there are plenty of structures which are related to the piriformis. Plenty of structures related to the piriformis. Piriformis is therefore known as the key muscle of the gluteal region. Can anyone tell me? No problem. Can anyone tell me what is this nerve which emerges at the upper border of piriformis? Students, there's only one nerve which emerges at the upper border of piriformis. I have drawn this with an arrow. This is a nerve which emerges at the superior border of piriformis. Anyone? Can anyone answer this? Yes? Bolo. Answer. I'm waiting. Don't hesitate to answer. You answer whatever it is. Okay, even if it is wrong, it's okay. You learn from your mistakes. Always. So, there's only one nerve. Very good. This is the superior gluteal nerve and vessels. The superior gluteal nerves and vessels arises at the superior border of piriformis. Students, this superior gluteal nerve and vessels, the superior gluteal nerve especially, is going to supply what? This is another MCQ. Another very important MCQ. The superior gluteal nerve is going to supply what? It supplies three muscles. Any guesses? Can anyone guess this? The superior gluteal nerve supplies three muscles. One is the gluteus medius, second is the gluteus minimus, and third which is inserted into the iliotibial tract, which makes the tract tense. What is that muscle? Come on students. That's the tensor fascia lata. A very important MCQ, okay? Gluteus medius and minimus, yes. So the superior gluteal nerve supplies the gluteus medius, minimus, and the tensor fascia lata. Out of this, what is the action of gluteus medius? What is the action of gluteus minimus? This is another very important thing. So I'll just touch this topic and go. So what is the action of gluteus medius? Can anyone specify? Gluteus medius. Gluteus medius is inserted on the lateral aspect of the greater trochanter. On the lateral aspect. Excellent. That's abduction. Abduction at the hip joint. Very good. The action of gluteus medius is abduction. The action of gluteus minimus is medial rotation. Gluteus minimus is inserted on the anterior aspect of the greater trochanter. Gluteus medius on the lateral aspect. Minimus on the anterior aspect of the greater trochanter. Action of medius, abduction. Action of minimus, medial rotation. When we talk about these two muscles, we always talk about them together. So what is the action of gluteus medius and minimus? Abduction and medial rotation at the hip joint. Very good. abduction and medial rotation at the hip joint. And these two muscles, when they contract, they also support the pelvis when one foot is off the ground. They support the pelvis when one foot is off the ground. That's a very important sign. That's a very important action of gluteus medius and minimus. They support the pelvis when one foot is off the ground, and that is why students, when there's an injury to the gluteus medius and minimus, when a person lifts his foot, the pelvis droops. And what is this sign known as? The Trendelenburg sign. What is the gait known as? The gait is known as lurching gait. If it's a unilateral paralysis, it's lurching gait. If it's a bilateral paralysis, it is waddling gait. Waddling gait. Perfect. Okay, so what is this nerve which emerges at the lower border of piriformis? That's the sciatic nerve. Sciatic nerve. And what is this nerve? That's the posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. Students, I just would like to, tell you this cutaneous nerves of the thigh. Cutaneous nerves of thigh. These are of four. These are four in number. Cutaneous nerves of thigh. Four in number. One is the anterior cutaneous nerve, medial cutaneous nerve of thigh, lateral cutaneous nerve of thigh, and the posterior cutaneous nerve of thigh. Can anyone just put a light upon this? The posterior cutaneous nerve of thigh is a branch of sacral plexus. Okay, posterior cutaneous nerve of thigh is a branch of sacral plexus. The lateral cutaneous nerve of thigh is a branch of what? Come on, students, if you can answer this. The lateral cutaneous nerve of thigh is a branch of lumbar plexus. It's a branch of lumbar plexus. Any clinical condition associated with this, students? Any clinical condition associated with this? Any clinical condition associated with lateral cutaneous nerve of thigh? This lateral cutaneous nerve of thigh comes at the most lateral aspect of the inguinal ligament. It's a branch of lumbar plexus and it comes at the most lateral aspect of the inguinal ligament, and this lateral cutaneous nerve of the thigh gets compressed against the inguinal ligament. It gets compressed. Yes, very good. This is what we call as meralgia paresthetica. This is what we call as meralgia paresthetica. Yes, that's a compression of lateral cutaneous nerve of thigh against the inguinal ligament. That's meralgia paresthetica. Anterior and medial cutaneous nerve of thigh are branches of anterior division of femoral nerve. These are branches of anterior division of femoral nerve. Okay, so just remember this. Medial and anterior cutaneous nerve of thigh are branches of anterior division of femoral nerve. Perfect, perfect. Okay, I would like to tell you this also. What is this ligament? Students, if you can quickly tell me, what is this ligament that I am highlighting here for you? What is this ligament? Anyone? What is this ligament? This is the sacrotuberous ligament. And this sacrotuberous ligament represents the degenerated part of a muscle. What was that? Yesterday, did I tell you this? Sacrotuberous ligament. That's a degenerated part of the long head of biceps femoris. Degenerated part of long head of biceps femoris. Can anyone tell me sacrospinous ligament? Sacrospinous ligament is a degenerated part of what? Yes, students. These are all degenerated parts. Sacrospinous ligament. Can anyone tell me? We had a tail first, tail. And which is the muscle which goes into the tail? The tail is very strong. The animal hits with the tail. What is that muscle? Coccygeus. Very good. And as the ancestors came down, started walking on two legs, the function of the tail went off. The muscle got degenerated. The coccygeus got degenerated, become a ligament named the sacrospinous ligament. It's a degenerated part of coccygeus muscle. Coccygeus. Very good. Then I'll just add this also. Tibial collateral ligament. Tibial collateral ligament is a degenerated part of. Can anyone answer this? Tibial collateral ligament is a degenerated part of. Come on, come on, come on. Answer, students. I'm waiting for your answer. Tibial collateral ligament is a degenerated, or you call this as medial collateral ligament. That's a degenerated part of adductor magnus. Tibial collateral ligament is a degenerated part of adductor magnus. fibular collateral ligament. Fibular collateral ligament is a degenerated part of peroneus longus. It's a degenerated part of peroneus longus. Tibial collateral, adductor magnus, fibular collateral, peroneus longus. And one last, oblique popliteal ligament. Oblique popliteal ligament is a degenerated part of what? Can anyone answer this? This is very important. This you need to know. Oblique popliteal ligament is a degenerated part of, yes, can anyone answer this? It's a degenerated part of oblique popliteal ligament. Because this you should know, it lies in the popliteal fossa. Semimembranosus. Very good students. Semimembranosus. Semimembranosus. Perfect. So oblique popliteal ligament is a degenerated part of semimembranosus, and this oblique popliteal ligament lies in the floor of the popliteal fossa, and this oblique popliteal ligament is pierced by something. Yes, anyone, can you answer this? This oblique popliteal ligament is pierced by something. What is that? Oblique popliteal ligament is pierced by, answer this, this is a very important MCQ. This is pierced by middle genicular vessels. Middle genicular vessels, and this middle genicular vessels are branches of what? Or middle genicular artery is a branch of what? Anyone? Middle genicular vessels, middle genicular artery is a branch of what? Which is the artery which gives branches with the name of genicular? Genicular is to supply the joints, to supply the knee joint. Which is that artery which gives branches? There is superior lateral, superior medial, inferior lateral, inferior middle, and middle genicular. Yes, that's the branch of popliteal artery. Excellent, very good. It's a branch of popliteal artery, and this is going to pierce the oblique popliteal ligament, the middle genicular vessels. Excellent, very good to all of you. And students, what is this group of muscles? Can anyone answer this? This group of muscles, another very important MCQs that you get here. What is this group of muscles? This is the hamstrings. Hamstrings. And what is the origin of hamstring? The hamstring would arise from the ischial tuberosity. Correct? The hamstrings arise from the ischial tuberosity. If I just make a slide for you like this, there are plenty of MCQs that comes on this topic, and there is a lot of confusion amongst the students. If I quickly tell you this is lateral and this is medial, students. What do you call this as? Suprolateral quadrant of the ischial tuberosity. This is the supromedial quadrant of the ischial tuberosity. That's the infrolateral, and that's the infromedial quadrant. Okay? So you divide the ischial tuberosity into 4 quadrants: supralateral, supromedial, infralateral, infromedial. Students, can anyone tell me what is this muscle which arises from the supralateral quadrant? Supralateral is the semimembranosus. Semimembranosus. From the supralateral quadrant arises the semimembranosus. From the supromedial quadrant arises what? Yes, from the supromedial quadrant arises the semitendinosus and the long head of biceps femoris. Semimembranosus, semitendinosus, and the long head of biceps femoris from the supromedial aspect. This is the easiest way to understand, and this is the easiest way. Just remember this. Plenty of MCQs you get on this origin of hamstring muscles as one of the options in the MCQs. So supromedial aspect is the semitendinosus with the long head of biceps femoris. Supralateral is semimembranosus. Infralateral is the adductor magnus. Infralateral is the adductor magnus. And what about the infromedial aspect? Infromedial aspect does nothing here. There is a bursa here. Bursa. And we are actually sitting on this bursa. Students, when we sit on the ischial tuberosity, we are actually sitting on this bursa. And inflammation of the bursa over the ischial tuberosity is known as what? Weaver's bottom. Inflammation of the bursa over the ischial tuberosity is known as Weaver's bottom. Clear? Inflammation of prepatellar bursa is known as housemaid's knee, and inflammation of infrapatellar bursa is known as clergyman's knee. Clergyman's knee, housemaid's knee. Okay, so just remember this. Right, inflammation of prepatellar bursa, housemaid's knee. Inflammation of infrapatellar bursa is the clergyman's knee. Okay, fine. So we've discussed a lot about this topic. Come on, students, answer this. During cardiac surgery, a surgeon finds a large vein in the posterior atrioventricular groove. He identifies it as coronary sinus. All of the following are tributaries of coronary sinus except. Answer this. Anyone? Anyone else? Anyone? Come on, students, come on, you can crack this MCQ. Yes, students. So all the following are tributaries of coronary sinus except answer is anterior cardiac vein for this. Anterior cardiac vein. Okay. The anterior cardiac vein directly opens into what? The right atrium. It drains into the right atrium. Directly, it drains the anterior surface of the heart. It opens into the right atrium. Any other veins which opens into the right atrium? These are the venae chordae minimi or Thebesian veins. Okay, venae chordae minimi or the Thebesian veins. This also directly opens into the right atrium. Okay, so they open into the right atrium. Students, you tell me the middle cardiac vein is lying in which groove? Middle cardiac vein. Can anyone answer this? Middle cardiac vein lies in which groove? Students? Anyone? Okay, I'll make the heart for you. I'll quickly make the structure of the heart for you. Just have a look. That's how the heart looks. That's the infundibulum. These are the pulmonary arteries. That's the arch of aorta. What is this? This is the right atrium. That's the right ventricle. That's left ventricle. This is the anterior atrioventricular groove. Now we go back. This is the posterior atrioventricular groove. This is the anterior interventricular groove, and that's the posterior interventricular groove. Tell me, students, what is the artery that we get here? Come on, answer this and be quick. So what is this artery that we get here? This is the right coronary artery. The right coronary artery runs in the anterior atrioventricular groove. Now goes here. What is this? This is the posterior atrioventricular groove. The right coronary artery gives a branch here. What is this? This is the posterior interventricular artery, and this posterior interventricular artery runs in the posterior interventricular groove. What is this artery here? This is the left coronary. It's a long artery, comes from behind the pulmonary trunk and divides into two branches. One, what is this? Can anyone answer this? What is this artery which runs in the anterior interventricular groove? This is the left anterior descending. Left anterior descending runs in the anterior interventricular groove, goes in the posterior interventricular groove, and this is going to anastomose with what? The posterior interventricular branch of right coronary artery. And what is this artery which is going to wind around the heart? Students, what is this? This is the circumflex branch of left coronary artery, goes in the posterior atrioventricular groove and anastomoses with the right coronary artery. Right coronary artery. Okay, so I'll just quickly label this for you. This is the right coronary artery here. This is the posterior interventricular branch of right coronary artery. Posterior interventricular branch of right coronary. This is the left coronary artery. This is the left anterior descending, and this is the circumflex branch. Perfect. Students, quickly answer now. What are the veins? Veins. Tell me, what is this vein that you get here in this groove? in the anterior interventricular sulcus of the heart. What is the vein? So the arteries and the veins are done for you. Students, come on. What is this vein? This is the small cardiac vein. Small cardiac vein. That's a small cardiac vein. What is the vein that we get here in this groove? This is the great cardiac vein. Great cardiac vein. What is the vein that you get in this groove? In this groove, this is the middle cardiac vein. Middle cardiac vein. And what is the vein that you get in this groove? This is the largest vein of the heart, students, and this is what we call as the coronary sinus. Coronary sinus. The coronary sinus lies in which groove? The coronary sinus lies in the posterior atrioventricular groove. Posterior atrioventricular groove. Is this clear to all of you, students? So I've just finished the arteries and the veins. This will be very easy for you. You get MCQs on this. You get visuals on this. Be very clear. Okay, I'll just quickly repeat this. In the anterior atrioventricular groove, the artery is the right coronary, the vein is the small cardiac vein. In the anterior interventricular groove, the artery is left anterior descending, the vein is the great cardiac vein. In the posterior atrioventricular groove, there's going to be an anastomosis here. Anastomosis between the right coronary artery and the circumflex branch of left coronary artery. Right coronary and the circumflex branch of left coronary. The vein which we get here is coronary sinus, and in the posterior interventricular groove, there's an anastomosis between the LAD and the posterior interventricular branch of right coronary. The vein is the middle cardiac vein. Middle cardiac vein. Perfect. Okay, so that's about I've told you the entire venous drainage and the arterial supply of the heart. Clear, students? Come on, students, identify this pointed structure. Identify this pointed structure. Anyone? Again, a mixed bag, some MCQs, some visuals for you. And this is a very important visual slide, a very important MCQ for you. Anyone? Identify the pointer structure. Come on, students, come on. You can crack this. Oculomotor nerve, very good, very good. Rishi, yes, that's the oculomotor nerve. Great. So, if you can quickly tell me, I'll magnify this part for you. And see, students, just quickly answer this now. Tell me, that's the oculomotor nerve. What is this part of the brainstem known as? This part of the brainstem. I'm putting a pointer for you. What is this part of the midbrain known as? Come on, come on, come on. This is what we call as the crus cerebri. Crus cerebri. This part of the midbrain is known as the crus cerebri. This is the ventral part of the midbrain, ventral part of the midbrain. If we go on the dorsal aspect of the midbrain, we find the superior and the inferior colliculus, and that part of the midbrain would be known as tectum of the midbrain, with the superior and the inferior colliculus. So this is the crus cerebri, also known as the cerebral peduncles. And what is this nerve? That's the third nerve, oculomotor nerve, and there will be a nerve coming from the dorsal aspect. He is not drawn here. That would be the trochlear nerve, trochlear. So what is this, students? That's the pons here, and there's an artery right in the midline of the pons. Can anyone answer this? What is the name of this artery in the midline of the pons? That's the basilar artery. The basilar artery lies in the sulcus, which is known as the basilar sulcus or the cisterna pontis. Cisterna pontis, this would be the basilar artery, and the basilar artery will give branches to the pons. What is this structure which is pointed? I'm telling you the entire slide, students. These are all very important visuals. What is this structure which is going from the pons towards the cerebellum? What is that? This is the middle cerebellar peduncle. This is the middle cerebellar peduncle, students. And what fibers do pass from the middle cerebellar peduncle? These are the pontocerebellar fibers. Pontocerebellar fibers. What is this nerve attached at the junction of pons with the middle cerebellar peduncle? Can anyone tell me? What is the nerve attached at the junction of pons with the middle cerebellar peduncle? This is the trigeminal nerve. Trigeminal nerve attached at the junction of pons with the middle cerebellar peduncle. Perfect. What is this elevation? That's the medulla here. What is this junction known as? First tell me, what is this junction known as between the pons and the medulla? This is what we call as the pontomedullary junction. There will be 3 nerves attached here. The 6th, the 7th, the 8th nerve. He's not drawn that. That's the pyramids, that's the olives here. This is the pyramids, that's the olives here. Between the pyramids and the olives, you get a nerve. That's the hypoglossal nerve. Between the pyramids and the olives, you will be getting the hypoglossal nerve. Perfect. Fine. What is this? Can anyone tell me what is this structure? What is this structure? Yes, students, what is this structure? Anyone? Come on, students, you can crack this. What is this structure? And what is this area known as? What is this area? What is this area known as? Can anyone tell me what is this area known as? That is the mammillary body. Very good. That's the mammillary body. And what is this rhomboid shaped structure known as? This is extremely important. This is very important. No, pineal gland nahi hai, Upendra. That's the mammillary body. That's the mammillary body. Yes, Rishi has answered it. Very good. That's the mammillary body. Don't retract messages. That's fine. That's the mammillary body. Fine. And tell me, what is this diamond shaped structure? Yes, Rishi. What is the diamond shaped structure? The rhomboid shaped area. This is what we call as the interpeduncular fossa. Very good, you got that right. That's the interpeduncular fossa. And what are the boundaries of the interpeduncular fossa? On either sides is the optic tract. On either sides is the optic tract. Anterolaterally and posterolaterally is the crus cerebri. Crus cerebri. Anterolaterally is the optic tract. Posterolaterally is the crus cerebri. Okay. And what are the contents of the interpeduncular fossa? The contents are going to be the third nerve and the circle of Willis. Third nerve and the circle of Willis. The contents of interpeduncular fossa. This is the third nerve. Also, there's going to be the circle of Willis. Perfect. Any doubts in this? Any doubts in this slide? You tell me. Should I proceed? Students. Perfect. Very good. Okay. Which circle? The circle is mammillary body. This is the mammillary body. This is the mammillary body. Mammillary body. Fine. Okay, see the next MCQ. Answer this. And that rhomboid shaped structure is interpeduncular fossa. Upendra. A 68 years old man comes to the physician because of 4 months history of difficulty in swallowing. During this time, he has a 7 kg weight loss. Esophagoscopy shows an exophytic mass in distal 1/3 of esophagus. Histological examination of biopsy specimen shows a well differentiated adenocarcinoma. The patient is scheduled for resection of the tumor. During the procedures, the surgeon damages the structure that passed through the diaphragm along with the esophagus. Yes, you got that. The answer is, what is the structure which goes at T10 along with the vagus? That's the vagus. T10 along with the esophagus. That's the vagus nerve. Vagus nerve. What passes at T8 vertebral level? Students, can you quickly tell me? At T8 vertebral level, what passes is the IVC and the right phrenic nerve. IVC and the right phrenic nerve. Clear? T10 is the esophagus with right and left vagus. Esophagus with right and left vagus. T12 is the aorta. Aorta, azygous vein and thoracic duct. Aorta, azygous vein and the thoracic duct. Very good. So T8 is IVC and the right phrenic nerve. Remember, the right phrenic nerve goes with the IVC. The left phrenic nerve is directly going to pierce the diaphragm and enter the abdomen. T10 esophagus with right and left vagus. T12 is aorta, azygous vein and the thoracic duct. Tell me students, how does the subcostal nerve from the thorax enter the abdomen? Can anyone tell me? How does the subcostal nerve from the thorax enter the abdomen? Anyone? Subcostal nerve? See, what am I drawing? If you can quickly tell me. Students, tell me, what is this that I've drawn for you? Anyone? What is this number 1? What is this number 2? And what is this number 3? Can you answer this? These are the parts of the diaphragm, students. These are the parts of the diaphragm. What is this number 1? Come on, students. These are very important things. You should know that. Yes, Rishi, what is this? This is the arcuate. Yes, number 2 is what? 2 is the medial arcuate ligament. Medial arcuate ligament. 3 is lateral arcuate ligament. And 1 is what? 1 is the crus of the diaphragm. 1 is the crus of the diaphragm. Crus. Tell me, what enters the abdomen behind the lateral arcuate ligament? Can anyone tell me? There's someone who enters the abdomen behind the lateral arcuate ligament. And there's someone who comes behind the medial arcuate ligament. Come on, students, answer this. A very important MCQ. There's someone who enters the abdomen behind the lateral arcuate ligament. Anyone? Anyone? These are the subcostal nerve and vessels. Subcostal nerves and vessels. What is this? Sympathetic chain. Sympathetic chain. And who's going to pierce the crus of the diaphragm and enter the abdomen? Can anyone tell me? These are the splanchnic nerves. Splanchnic nerves. So who pierces the crus of the diaphragm and enters the abdomen? These are the splanchnic nerves. Can anyone tell me what are these splanchnic nerves? What do they represent? Subcostal nerve, Rishi. That is subcostal nerve and vessels. That's not epigastric. Epigastric आगे से आता है. It comes to the anterior. This is posterior. This is on the vertebral column. ये posterior है. Anteriorly there would be the sinus of Larry or the sinus of Morgagni or the space of Larry. And what comes in through the space is the superior epigastric artery. Okay. What are these splanchnic nerves? One is the greatest splanchnic. Greatest splanchnic. One is lessest splanchnic. Lessest splanchnic. And one is the least splanchnic. Greatest splanchnic, lessest splanchnic, least splanchnic. Greatest splanchnic arises from T5 to T9 sympathetic ganglions. T5 to T9 sympathetic ganglions. T5 to T9. Lessest splanchnic T10 and T11 sympathetic ganglions. Least splanchnic arises from T12 sympathetic ganglion. Okay, so greatest splanchnic, lesser and least splanchnic. Greatest splanchnic arises from T5 to T9 sympathetic ganglions. Lesser splanchnic T11, T2, T10, T11 and least is T12. Now these are the sympathetic fibers. Sympathetic, preganglionic sympathetic fibers. Okay, preganglionic sympathetic fibers. These are known as splanchnic nerves. Okay, fine students. I'll proceed then. Preganglionic sympathetic fibers. Okay, we'll go to the next slide. Have a look. Identify this pointed structure. Yes. Anyone? Can you identify this pointed structure? Come on students, you can crack this MCQ. Come on, identify this pointed structure. I've already told you, I think, and the previous classes. Ansa cervicalis, you got this, Ajit, you got this. Ansa cervicalis. And this ansa cervicalis lies on what? Ansa cervicalis is going to lie on the anterior wall of carotid sheath. It lies on the anterior wall of carotid sheath. Can anyone tell me what is this that I'm pointing for you? What is this structure? As soon as you get such dissected specimens, you're going to get such dissected specimen for visuals. You have to be very clear about this. What is this cord-like structure that I've pointed? Huh? No, that's not internal carotid. The one in blue arrow. The one in blue. Can you see this? I'll magnify this, but I'll magnify this for you. One moment. What is this cord-like structure? Tell me. Anyone? I'm not getting that magnification icon. Okay, let me see. This is the brachial plexus. This is the brachial plexus. This is the brachial plexus. Yes. The cord-like structure which I pointed, this is the brachial plexus. If that's the brachial plexus, students, if that's the brachial plexus, what is this muscle going to be? This muscle. If that's the brachial plexus, what is the muscle in front of the brachial plexus going to be? Can anyone answer this? Name of the muscle. Huh? Yeah, that's fine. That's the trunk of the brachial plexus, Ajit. That's fine. What is the muscle in front? I'm asking. What is the muscle in front of the brachial plexus? I pointed that muscle. Scalenus anterior. Very good. That's the scalenus anterior muscle. And what is this muscle behind the brachial plexus? This one. Behind the brachial plexus. Scalenus medius. The one in front is going to be the scalenus anterior, students, and the one behind the brachial plexus is going to be the scalenus medius. Remember, this you should know. This you should know. This is the scalenus anterior, and that's the scalenus medius. I want you to know that the brachial plexus and the subclavian artery in the neck lies between the scalenus anterior and the scalenus medius. Between the scalenus anterior and the scalenus medius. Perfect. What is this? This is the internal jugular vein. This is the internal jugular vein, and this is going to be the internal carotid artery. That's the internal jugular vein, that's the internal carotid artery. Okay. Can you tell me what is this? What is this structure? Huh? Anyone? What is this structure? Okay, I got this. One moment, I'll magnify this. Vagus is not seen. Vagus is between the artery and the vein. Vagus and artery and vein के बीच में होती है. Sorry. One moment, I'll just magnify this for you. Students, look. Now is it clear? देखो, ये internal jugular vein है, ये internal carotid artery है. The vagus is right between the internal jugular vein and internal carotid artery. It's difficult to point out that. You tell me what is this vein? I'm asking you what is this vein? ये internal jugular vein है. What is this vein coming and draining in the internal jugular vein? Students. What is this vein coming and draining in the internal jugular vein? Retromandibular. Retromandibular doesn't drain into internal jugular, Upendra. Retromandibular vein has two divisions, anterior and posterior. Yes, any hint? I've given you a hint. Can anyone guess this now? See, this is the facial vein. Now I can't write on this. This is the facial vein. This is the anterior division of retromandibular vein. That's the common facial vein, and this common facial vein is going to drain into the internal jugular vein. Students, are you getting this? That's the internal jugular vein. That's the common facial vein. This is the common facial vein, and this common facial vein is formed by the joining of the anterior division of retromandibular vein with the facial vein. The facial vein joins with the anterior division of retromandibular to form the common facial vein. It drains into the internal jugular vein. I hope this is known to you. This is clear to you. Okay, I'll quickly make a slide for you. I'll take this advantage to make a slide for you. Students, especially for you, look at this fast. Okay, that's the body, that's the ramus of the mandible. Okay, quickly I'll start with the veins. Answer now. What is this vein above the orbit? That's supraorbital. What is this vein above the here? There's a trochlea named supratrochlear. So supraorbital and supratrochlear vein joins to form a vein at the medial angle of the eye. That's the angular vein. The angular vein continues down as what? This is the facial vein. Facial vein. Now, what is this vein coming from up? That's the superficial temporal vein. And what is this vein? That's the maxillary vein. The superficial temporal and maxillary joins to form the retromandibular vein. The retromandibular vein divides into an anterior and posterior divisions. Anterior division of retromandibular joins with facial to form the common facial vein. This common facial vein drains into internal jugular vein. This drains into internal jugular vein. The posterior division of retromandibular vein joins with, what is this? This is the posterior auricular vein, and now it forms a vein here. What's that? External jugular vein drains into subclavian vein. I hope this is clear to you. Okay, so that's supraorbital, supratrochlear, that's angular vein, that is facial vein. This is superficial temporal, that's maxillary, that's retromandibular, anterior posterior divisions, anterior division of retromandibular joining with facial to form the common facial vein. And this common facial vein drains into internal jugular vein, posterior division joins with posterior auricular vein, forms the external jugular vein that drains into the subclavian vein. And now students, if you can quickly tell me what is this structure that I've drawn here, here. Come on. This is the parotid gland. This is the parotid gland. Wait, I'll tell you. This is the parotid gland. And what are the contents of the parotid gland? The first content is the facial nerve, followed by the retromandibular vein, followed by the external carotid artery. Okay. Facial nerve, retromandibular vein, and the external carotid artery. I'll tell you the tributaries of external jugular vein slowly. One is the tributaries of internal jugular vein. One I've told you, common facial vein. Common facial vein is one of the tributaries of internal jugular vein. The second one, which is coming and draining into the internal jugular vein, is the subclavian vein. Subclavian. Can anyone tell me which is the first tributary of internal jugular vein? Students, the first tributary of internal jugular vein. Yes? Yes, Ajit, can you tell me the first tributary of internal jugular vein? So then gradually as we proceed, I'll tell you the tributaries. The first tributary of internal jugular vein. The vein which comes out through the anterior compartment of the jugular foramen. Yes, that's a hint for you. The vein which comes out through the anterior compartment of the jugular foramen, it joins with the internal jugular vein. What's that? Inferior petrosal sinus. Very good. So one is the inferior petrosal sinus, that's the first tributary of internal jugular vein. The second is the common facial vein. There are more to come. We'll come to this. You get this vein from thyroid also. Okay, I'll tell you as we proceed. Chalo, coming to this MCQ. Tell me students, identify this histological picture for you. This histological structure. Can anyone identify this? Come on students, come on. You can crack this. Crack this visual. Let's crack it. Anyone? Anyone? What do you think is this histological slide? Look now, you can see the structure here, no? Yeah, as a finger shaped structure dikhta hai na. You can see this finger like processes. What are these finger like processes known as? These are the villus. Those finger-like structures are the villus. Yes, so villus, the moment you see villus, it has to be what? The small intestines. It has to be the small intestine, correct? So it would either be duodenum, it would be jejunum, or it would be ileum. Three things. Okay, so this finger-like projections are the villus. So it would either be duodenum or jejunum or ileum. How do you differentiate between this? No, it's not respiratory epithelium. Rashi, it's not... Rishi, sorry, it's not respiratory epithelium. A respiratory epithelium is pseudostratified ciliated columnar with goblet cells. Pseudostratified ciliated columnar with goblet cells. Yes, very good. Salin, very good. These are finger-like structures. So these are the villus. And now If I see this is the submucosa, and in this submucosa you can see this glands here. Students, you can see this glands here, and this are the Brunner's glands. These small glands which you're seeing, yes students, these are the Brunner's glands. So Brunner's glands are characteristic of what? Duodenum. Duodenum. So this has to be duodenum. So Willis with Brunner's glands, that's duodenum. Willis with, if I get large follicles here, I mean lymphoid follicles here, I don't get this Brunner's glands, but in the submucosa, if I get this lymphoid follicles, what is this? This lymphoid follicles are nothing but the Peyer's patches, and Willis with Peyer's patches is going to be what? Can anyone answer this? Willis with Peyer's patches. I get this blue lymphoid follicles. Yes. So that's the ileum. So Willis with Peyer's patches is going to be the ileum, and Willis with nothing specific. You do not get Brunner's glands, neither do you get Peyer's patches, and this is going to be what? The ileum. I'm so sorry. This is going to be the jejunum. Jejunum. So nothing specific, that would be the jejunum. I'm so sorry. Jejunum. Correct. So Willis with Brunner's glands, duodenum, Willis with Peyer's patches, ileum, Willis with nothing specific, that is going to be the jejunum. Okay. Fine. Just look at this slide. Students, just look at this slide. You can see this finger-like projections here. Nothing specific in the submucosa. This is going to be a slide of jejunum. Okay. Coming to the next MCQ, students. Coming to the next MCQ. Here we go. Answer this. Students, answer this. Identify the structure passing through the marked foramen. Yes, anyone? What is the marked foramen? First you tell me. Identify the structure passing through the marked foramen. Mandibular nerve. No. What is the foramen, you tell me? What is the foramen? What is the pointed foramen? Students, what is the pointed foramen? You can see the black pointer on the foramen. Answer is C for this. C, that's the foramen rotundum. It's not foramen rotundum. No, it's not foramen rotundum. It's the foramen spinosum. It's the foramen spinosum. Look, I'll just magnify this for you. I'll magnify this. Abhi dekho. Now see this. This is the foramen rotundum. What is this now? That's the middle cranial fossa. That's the lesser wing of sphenoid. That's a pitreous part of temporal bone. So this is the anterior cranial fossa. That's the middle cranial fossa. And this is going to be the posterior cranial fossa. This is the cribriform plate of ethmoid bone, and what comes in from there are the olfactory nerves. What is this, students? Identify this. Come on, quickly, you answer. What is this? Even if it is wrong, that's fine, you answer. You should know this, and you get visuals on the foramens also. What is this? This is the picture is not clear. Dakshita, picture is not clear. Okay, now see. That's the optic canal. And what passes from here is the optic nerve and the ophthalmic artery. The optic nerve comes in and the ophthalmic artery gets out. Optic nerve and ophthalmic artery. That's the lesser wing of sphenoid. And just below the lesser wing of sphenoid, there's a long fissure. What's that? The superior orbital fissure. This is the superior orbital fissure. And what goes to the superior orbital fissure? The third nerve, the fourth nerve, the sixth nerve, and the ophthalmic division of trigeminal nerve. The third nerve, the fourth nerve, the sixth nerve, and the ophthalmic division of trigeminal nerve passes through the superior orbital fissure. Perfect. What is this foramen? That's the foramen rotundum. Be very clear, students. This is the middle cranial fossa here. That's the middle cranial fossa. That's the foramen rotundum. Foramen rotundum. What passes from here? Foramen rotundum. What passes from here? The maxillary nerve. That's the maxillary nerve which passes from here. Yes, yes. Superior and inferior ophthalmic vein is correct. Yeah. What passes through this? Foramen rotundum? Yes, that's the maxillary nerve. What passes through this is the foramen ovale. That's the foramen ovale. What passes through it is M-A-L-E. M is mandibular nerve. A is the accessory meningeal artery. L is the lesser petrosal nerve. And E is the emissary vein. Emissary vein. M-A-L-E. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. What passes through the foramen spinosum? Through the foramen spinosum passes the nervus spinosus and the middle meningeal artery. The nervus spinosus and the middle meningeal artery. Fine. What is this now? That's the petrous part of temporal bone. And this is very hard like a rock. It's very hard like a rock, the petrous part. Now what lies in this? The middle here and the internal here. And what is this foramen here? Students, what is this foramen here? This is the internal acoustic meatus. This is the internal acoustic meatus. What passes? The 7th nerve, the 8th nerve and the labyrinthine artery. Through the internal acoustic meatus, 7th nerve, 8th nerve and labyrinthine artery. That's the jugular foramen. And what passes through the jugular foramen? You know now, 3 compartments, anterior, middle, posterior. Through the anterior compartment passes the inferior petrosal sinus. Through the middle compartment goes the 9th, 10th and 11th cranial nerves. And through the posterior compartment goes the sigmoid sinus. That's the foramen magnum. On either sides, there is the hypoglossal canal. You can see here, this is the hypoglossal canal, also known as the anterior condylar canal. And what passes through this? Hypoglossal nerve. Right, students? What is this groove for? Can anyone tell me what is this groove for? Yes, students. What is this groove for? That's the groove for transverse sinus. That's the groove for transverse sinus. And what is this S-shaped groove for? That's the groove for sigmoid sinus. This is the groove for transverse sinus and this is the S-shaped groove for sigmoid sinus. Sigmoid. Okay, clear, students? Clear to all of you? And you tell me there's someone here who's lying on the, like this. There's someone here. Can anyone tell me what is this? There's someone who's covering this. There's someone who's attached to the petrous part of the temporal bone. It's not writing here. Attached to the petrous part of temporal bone on either sides, and it is attached to the occipital bone behind. What is this that I've drawn for you? Can anyone tell me? Yes, students. It's not writing on this. Yeah, tell me. What is this? This is a fold of dura mater, and this fold of dura mater is going to separate the cerebral cortex from the cerebellum below. The cerebrum above from the cerebellum below. And what is this fold of dura mater known as? No, Rishi, no. What is it? It's going to separate the cerebrum, the occipital lobe of the cerebrum from the cerebellum. Anyone? What is that known as? Yes. This is acting as a tent for the cerebellum. Acting as a tent for the cerebellum. Yes, that's the tentorium cerebelli. The tentorium cerebelli. Yes, that's the tentorium cerebelli. It acts as a tent for the cerebellum. The tentorium cerebelli. Perfect, perfect. So I hope you are clear with everything. And what are these impressions on? You can see these impressions on the lateral side or in the interior of the skull. These are the impressions of the middle meningeal artery and its branches. You will be getting the impressions of the middle meningeal artery and its branches. So if there's a hemorrhage here, this hemorrhage is outside the dura mater, and this is what we call as an extradural hemorrhage. Extradural hemorrhage. It's between the dura mater and the skull, the branches of middle meningeal artery. So that is an extradural hemorrhage. Perfect. Okay. Okay, students, we go to the next MCQ. Chalo, answer this. Answer this MCQ. A newborn is delivered at term to 19-year-old primary gravida woman via spontaneous normal vaginal delivery. The mother had no prenatal care. On examination, the child has a small retracted jaw and hypoplasia of the zygomatic arch. The patient's condition is most likely caused by abnormal development of a structure that also gives rise to the following. What do you say? Anyone? Students, answer. So you tell me, see, retracted jaw, that means the maxilla, this mandible, the maxilla is not developed, the mandible is not developed. Hypoplasia of the zygomatic arch. So this maxilla mandibular develops from which pharyngeal arch? Answer is C for this. The maxilla and mandible develops from the first pharyngeal arch. It develops from the first pharyngeal arch. Correct, students? The maxilla, the mandible is derived from the first pharyngeal arch. Answer is C. Rishi, answer is C. This is a small retracted jaw. The first arch, yes, the first arch is defective. The first arch is defective. Very good. So what are the bones which are formed in the first arch? The malleus, the incus, the malleus, the incus is formed in the first arch. The maxilla, the mandibular, that's formed in the first arch. Okay. Answer is not D, no. Greater cornu of hyoid bone is derived from what? The greater cornu and the lower part of the body of hyoid bone is derived from what? Students, can anyone answer this? See, this is the lesser cornu of the hyoid bone and this is the greater cornu of the hyoid bone. Very good. So, the greater cornu and the lower part of the body of the hyoid bone, this is derived from the third arch. Here. The greater cornu and the lower part is derived from the third arch. The lesser cornu of the hyoid bone, this one, and the upper part of the body of the hyoid bone is derived from second arch. The lesser cornu and the upper part of the body of hyoid bone is derived from second arch. The greater cornu and the lower part of the body of the hyoid bone is derived from third arch. Facial nerve is a nerve which pharyngeal arch? Students, facial nerve is a nerve second pharyngeal arch. Second pharyngeal arch. Cricothyroid muscle. Can anyone tell me cricothyroid muscle is a derivative of fourth pharyngeal arch? Fourth pharyngeal arch. Cricothyroid is fourth. Why? Because which is the nerve of the fourth arch? The superior laryngeal nerve. The superior laryngeal divides into an external laryngeal, internal laryngeal. The external laryngeal nerve supplies what? Cricothyroid. And what is the action of cricothyroid? It's a tensor of the vocal cords. Cricothyroid, it's a tensor of vocal cords. So cricothyroid is derived from the fourth pharyngeal arch. Fourth pharyngeal arch. Facial nerve is second. Incus is first. Clear to all of you? Greater cornu is from the third arch. I hope this is clear to all of you students. Let me just brief you about our platform here. Let me just brief you students. So the NEET PG 2022 All India mock test is rescheduled on Feb 26 9 AM specially for you. Okay, it has been rescheduled. Feb 26, the NEET PG 2022 All India mock test, 9 AM. The final chance before the final exams. Enroll now. So you get a special offer going on. 3-month subscription, you get 1 month free. We've got this plus subscription in which there are daily live classes, live quizzes, learning from the top educators, access from the device of your choice, and now students, you can also access our question bank, right? The iconic subscription where you get the best of Unacademy and pre-planner. Now these are our FMGE toppers in the recent results declared in the month of December. They've got very good ranks and congratulations once again to all of them. We've got an educator curated test series, students. This is a subject-wise test series. Just have a look at the website to get the details of this. Now, special class features in which you've got live classes, poll for the learners, raise a hand technique, never miss a class with proper notifications being given. And if you miss it, you get lecture notes in the form of PDF. Anytime, anywhere, you can access the class and get your doubts solved. Now, students, a special under one roof. All the educators of Unacademy are coming there for you. A final revision before the exams for the NEET PG 21st May. Yes, a final revision. So all examiners are coming under one roof to teach you. That's for 3 months course. Focus FMG 2022 comprehensive batch, which is beginning from today. Yes, Focus FMG 2022 comprehensive batch. Some new courses coming up. Focus FMG December 2022 comprehensive batch. Okay, December. Target next 2023 subject wise batch starting from 11th of December. Download the Unacademy app and subscribe to it. And now see students, our iconic prices have further slashed down. Get the benefit of this and the plus subscriptions. Okay, you can avail additional 10% discount. Okay, fine students, any doubts here? Tell me, which are the muscles derived from the first arch? I'll just come back to this MCQ. Which are the muscles derived from the first arch? The one are the muscles of mastication. Then one is in the one is here. What's that? The mylohyoid, the anterior belly of digastric. Two more muscles, one in the ear, one in the palate, the tensor palati and tensor tympani. Okay, so muscles of the first pharyngeal arch, the four muscles of mastication, the temporalis, the masseter, the medial and the lateral pterygoids, one in the ear, one in the palate, the tensor palati, the tensor tympani muscles, the mylohyoid and the anterior belly of digastric. All these muscles are derived from the first arch. The nerve, the first arch is mandibular nerve. Therefore, all these muscles are supplied by the mandibular nerve thrills. Okay. Second arch, the muscles of facial expressions, the posterior belly of digastric, the stylohyoid, the stapedius muscle, the stapedius. Okay, so all these are derived from the second arch. Third arch, which is the muscle in the third arch? There's only one muscle in the third arch, and that's the stylopharyngeus muscle. Stylopharyngeus. The fourth and the sixth arch are the muscles of the larynx and the pharynx. Muscles of the larynx and pharynx in the fourth and the sixth arches. The fifth arch disappears off. Now, the first arch mandibular, second arch facial, third arch is glossopharyngeal, fourth is superior laryngeal, and the sixth arch is recurrent laryngeal nerve. Students, this is very important and this has to be perfect. The pharyngeal arches and all. Okay, I hope you have understood everything. You have understood everything. Thank you for this interactive session. Thank you to all of you. Good night. We'll stop here.